stationed at the Kenyatta National Hospital have been on strike for only 2 days, but the impact of their industrial action has been huge. The nurses had down their tools demanding the implementation of a collective bargaining agreement signed between their union and the government that would have seen an increment in their salaries and their allowances.
It's a suspension of the strike, isn't it?
Yes.
And there is also one document which has come in talking of issues relating to payment of the arrears in July, isn't it?
Yes.
That one gives us hope.
The strike has since been called off, but hot on its heel is another even bigger one. The doctors, nurses and clinical officers unions are threatening a strike in July. Their grievances, the planned move to have them paid from the counties.
The salaries for health workers must be maintained centrally. They can devolve all other functions. But for health worker salary, we need to have a structured process to avoid chaos.
But it just isn't matters of personnel management that will be a headache for the Cabinet Secretary in charge of the Ministry of Health. As he takes over the now consolidated ministry, he will have to stem the bleeding of public resources from medical facilities. Corruption in the ministry, especially in government-run institutions, has denied masses access to medical care. He will also have to devise ways of ensuring that the close to 40 million Kenyans across the country can easily and affordably access medical services. Access to medical care in the country has remained a challenge for successive governments, and attempts have been made at putting in place a mechanism to cushion the very poor from the high cost of health care with little or no success. Many will be hoping that the new government succeeds where the rest have failed. This ministry is also reeling from the lack of proper structures that will ensure equitable access of health services across the economic divide of the country. Many are hoping that the devolved government will help reduce the disparities that exist in the provision of health services, especially between the urban and rural areas. But the devolution of these services has already run into problems with the medical personnel.
The salaries for health workers must be maintained centrally. They can devolve all other functions. But for health worker salary, we need to have a structured process to avoid chaos.
The Cabinet Secretary in charge of this crucial sector will have to work extra fast and extra hard to make sure that the crucial services offered in this sector are streamlined. Brenda Wanga, NTV, at the Kenyatta National Hospital in Nairobi.